Chapter 30, the Urinary System. The introduction. So the urinary system consists of the kidneys, the ureters, the urinary bladder, and the urethra. So the function of the urinary system is to remove the waste products from the bloodstream and then excrete the waste in the form of urine. So if you look at the structure here of the urinary system, you'll see you have two kidneys, one on the left and one on the right. Your ureters are kind of these long tubes right here. You have two that take the urine from the kidneys down to the bladder. You have one on each side. And then your urethra right here is the part of the urinary system that actually delivers the urine into the outside world or into the toilet. And then the urinary bladder is actually the reservoir that's holding all the urine until it's ready to be excreted or expelled. And then you have your aorta, which grows right up to the heart, and then your inferior vena cava is the other part that's coming from the heart. Then your kidneys. So the function of the kidneys is actually to remove the metabolic waste products from the bloodstream. It also secretes two hormones. One is erythropoietin that stimulates the production of those red blood cells in the red bone marrow. And then it secretes renin as well, which helps maintain your blood pressure. And then if you look at the anatomy of the kidney, you have your renal cortex, which is at the top, your renal medulla, which is the middle portion of the kidney, your renal pyramids, they are divided into triangular shaped areas. Your renal columns, they're the portions of the cortex located between the pyramids. Your renal pelvis inside the kidney is formed by the expansion of the ureters inside the kidneys. And then the hilum, which is, I don't think it's on here. It is not. I'm so sorry. So the hilum is the renal artery, renal vein, and the ureter of the kidney. Then you have your minor and your major calculus. Your columns are here. Your arteries are right in there in that red section. The renal vein would be the blue. The pelvis is kind of where it, almost like it folds over itself a little bit. And then your renal papillae, which was right in between the top of the pyramid or the garlic. I always think it looks like a piece of garlic. Your renal pyramids are these sections that kind of look like a piece of garlic or a triangle. And then if you were to take a section of this kidney right here, like a cross section, you'll have your nephrons. The renal cortex will be at the top, the medulla's in the middle, and then you have all your collecting ducts that are in here. But we'll show you another image of that. So if you're looking at the anatomy of the nephron, so they're microscopic structures within the kidneys. They filter the blood, they remove waste products, and they form urine. Each kidney contains about 1 million nephrons located in the renal medulla. So the renal corpuscle is where the blood filtration occurs. It's composed of a mass of capillaries called a glomerulus. And that capsule that surrounds the glomerulus is called the Bowman's capsule or the glomerular capsule, which you can kind of see right in here. And then you have your renal tubules. You have your proximal convoluted tubule, which is, you have your distal, which is the further end, and then your proximal would be at the beginning of it. Then you have your loop of Henle, which kind of is the proximal convoluted tubules and the distal convoluted tubules together. It curves back around the renal corpuscle and starts to twist again, becoming the distal convoluted tubule. So if you kind of watch the way this cycle works, you'll see that it ends up being back over here into the distal convoluted tubule. The blood flows through the nephron in the following pathway. So it starts at the efferent arteriola, through the glomerulus, through the efferent arteriola, then the peritubual capillaries, and then the veins of the kidney. So take a little bit to look at the image here and get yourself familiarized with the different parts of the nephrons. You have your collecting duct down here, your loop of Henle, which is both the descending and ascending limbs. Descending is obviously going down. Ascending would be going up. Then your glomerulus is kind of like this little ball right here that has all the different tubes inside of it. Then your paratubule capillary are these smaller type veins that are up in here. And then your Bowman's capsule is the one that's surrounding the glomerulus. Your afferent areola, and then your efferent areola, which is over here. Then your urine formation. So there's three processes of the urine formation. So you have your glomerular filtration, tubular reabsorption, and then your tubular secretion. So in the glomerular filtration, this takes place in the renal corpuscles of the nephrons. The fluid part of the blood is forced from the glomerulars into the Bowman's capsule. Now that fluid that's inside the Bowman's capsule is called glomerular filtrate. So as the filtration pressure, it's largely determined by blood pressure. So if a person's blood pressure is too low, the glomerular filtrate will not form. So as the blood pressure increases, that means the filtration pressure also increases, causing the rate of filtration and the amount of filtrate to increase as well. So the sympathetic branch of the autonomic nervous system largely controls the rate of the filtration. So you don't really have to think about it happening. It just does it automatically. If the blood pressure or your blood volume drops, the sympathetic nervous system then causes those afferent areolas in the kidneys to contract. When this constriction occurs, the glomerular filtration pressure decreases and then less of that filtrate is formed. So you have here the key. You have your glomerular filtration, which is water and the solute smaller than proteins are forced through the capillary walls and the pores of your glomerular capsule. Then you have tubular reabsorption. The water, glucose, all your amino acids, and the needed ions are transported out of that filtrate into the tubular cells and then enter the capillary blood. And then tubular secretion is your hydrogen, your potassium, creatine, all the drugs that are removed from the paratubule blood, and then they're secreted by the tubular cells into that filtrate. So it's kind of, you see it coming in through the afferent areola as it goes through the capillaries, and then whatever is needed will get secreted into the tubes, come back around and get filtrated, and then once it's cleaned, it will get secreted back into the urine, so then it creates the urine that has all the waste products that your body does not need. Then we can talk about the tubular reabsorption. So the glomerular filtrate flows into the proximal convoluted tubule. The body needs to keep many of these substances, your nutrients, water, and ions that are found in the filtrate. All the substances to be kept pass through the wall of the renal tubule into the blood of the paratubule capillaries. And then during tubular secretion, substances move from the blood in the paratubule capillaries into the renal tubules. Those substances such as drugs, hydrogen, your waste products all get secreted into the, excreted in the urine. So what makes up your urine? The final solution that reaches those collecting ducts of the kidneys is called urine. It's mainly made up of water. It also normally contains urea, uric acid, trace amounts of amino acids, and various ions. Urea and the uric acid are waste products that your body does not need anymore. So they're kind of the breakdowns of those proteins and all those nucleic acids. And then the secretion of these waste materials help maintain that body's nice acid-base balance. The ureters, urinary bladder, and your urethra. So the ureters are those long muscular tubes that are carrying the urine away from the kidneys, and it's going down into the urinary bladder. There's a process called peristalsis, which is kind of like this rhythmic squeezing motion that helps deliver that urine from the kidneys down to the ureters into the bladder. So the bladder, the function is to basically store the urine up to about 600 milliliters until the body eliminates it. The internal floor of the bladder has 3 openings, 1 urethra and 2 ureters, also known as the trigone. The bladder is a smooth muscle. It expands and contracts. The reason it does that now, obviously, if you have more urine, it's going to expand. The less urine you have, it will contract. And that muscle is called the detrusor muscle. So micturition is actually the process of urination. So what happens is the stretching of that bladder triggers this process, usually when the bladder contains approximately about 150 milliliters of urine. So the bladder distends as it fills with urine. And then the first sensation to void is usually when the bladder is about half full. So then you're able to hold it until you're able to eliminate it in an appropriate time. The parasympathetic nervous system controls that detrusor muscle, which begins now those rhythmic contractions that trigger that sense of need to urinate. The brainstem and then the cerebral cortex send that impulse to the voluntary contract the external sphincter and help inhibit that need to urinate or micturition. Upon the desire to urinate, the external urethra now will open up and relax and is allowing the urine to flow through the urethra into the toilet. So if you look in here, so your bladder fills, the detrusor muscle now relaxes. So the ureter sphincter contracts, the pelvic floor contracts. Now on the second process, your first sensation to void. The bladder is half full, urination voluntary, inhibited until the appropriate time. Now you have the normal desire to void. What happens is now the detrusor muscle contracts, the pelvic floor relaxes, and then the urine will come out. And then your urethra, so that's actually the tube that moves the urine from the bladder to the outside world. They look a little bit differently from males to females. So if you see on the female over here, you have your ureters, and then the actual detrusor muscle of the bladder. You have your trigone right here, your internal urinary sphincter, and then your external urinary sphincter. And then on the males, your ureters are here. You still have the trigone. The only thing that's a little bit different, they have a prostate. So what that happens is your external ureter sphincter is in here. Obviously, for the guys, their urethra is on the outside of their body. So it has to come down this little tube here and then eventually go through the external urethra orifice. Now, common diseases and disorders of the urinary system. You have your acute kidney renal failure, which is your sudden loss of kidney failure. Some of the causes can be burns, dehydration, allergic reactions, obstructions of the renal artery, alcohol abuse, trauma to the kidneys, some kind of blood disorders in males that they have an enlarged prostate. Signs and symptoms would be decreased or no urine production or excessive urination, swelling of the extremities, bloating, some mental confusion, comas, hand tremors. You can also have nosebleeds, easily bruising. You have pain in the back or abdomen, abnormal urinalysis, and an increase in your potassium levels. The treatment for that is to modify the diet, increase the amount of protein, controlling your fluid intake. Antibiotics and dialysis may be needed. And if the underlying cause can be treated, acute renal failure can be reversed and the kidney function can then be returned back to normal. Your chronic renal failure is a condition in which the kidneys slowly lose their ability to function. They may have lost about 90% of their kidneys until they start showing symptoms. So causes can be diabetes, hypertension, kidney stones, obstructions of one of the ureters. Signs would be headache, mental confusion, comas, seizures, fluid retention, nausea, hypertension, increased or decreased urine output, UTIs, or abnormal urinalysis result. Treatments would be antibiotics, medications to control the anemia, restrictions of your fluids, controlling your high blood pressure, and then in serious cases, surgery may be needed to repair if you have a urethra obstruction, or also get a kidney transplant. Then your cystasis, that is a urinary bladder infection. Some of the causes is actually, especially those found in women, the bacteria from the females not wiping from front to back. They wipe from back to front, and they're causing some of the fecal matter bacteria to get into their ureter or into the urethra. You need to have good hygiene, urinating promptly when the urges occurs, and for females, making sure you're wiping front to back. Signs would be fatigue, chills, fever, pain, frequent need to urinate, and only a small amount of urine coming out when you go to use the bathroom. Your urine can often be cloudy and blood may be present. The treatment would be antibiotics, and when needed, you might be able to take pain medication, making sure you're drinking lots of fluids to help flush out that bacteria. And then glomerular nephritis. So that is inflammation of the glomeruli of the kidney. And then you can have chronic glomerular nephritis is one of the causes that can happen with your chronic renal failure. Some of the causes would be renal disease, immune disorders, or bacterial infections. Signs is hiccups, drowsiness, comas, seizures, high blood pressure, abnormal heart sounds, abnormal urinalysis, blood in the urine, or decrease and increase urine output. Treatment would be to have a low sodium, low protein diet, medications to control the high blood pressure, corticosteroids to reduce inflammation, and then dialysis may be another form of treatment. And then incontinence. So that's temporary or long-lasting condition other than a child when they cannot control the urge to urinate. This can happen, it develops more quickly in men than in females, or females are more likely to develop this incontinence than men because our bladder and urinary systems are on the inside of our body versus the males, their urethra is on the outside. Causes can be medications, excessive coughing, UTIs, nervous system disorders, and if you have bladder cancer. And then in men, prostate problems can lead to development of this disorder. And then again, for females, multiple pregnancies, if you have sphincter issues from surgeries, trauma can also cause incontinence. The signs would just be involuntary leakage of urine. Treatment they can do, removal of the prostate, Kegel exercises to increase the control of those urinary sphincters, surgery if it's really bad to repair the damaged bladders or the urethra sphincters. Polycystic kidney disease, that's when the kidneys enlarge because they are filled with cysts. This disease is usually develops relatively slowly with the symptoms worsening over time. The causes can be hereditary or not. Signs and symptoms would be fatigue, hypertension, anemia, pain in the back or in the abdomen, joint pain, heart murmurs, formation of kidney stones, blood in the urine, and liver diseases often can be symptoms of this disorder. Treatment would be medications to control the anemia, control your high blood pressure, blood transfusions. You can have the cyst drains, or if it's really bad, you would have to remove one or both of the kidneys. And then pyelonephritis. So that is a complicated UTI. That's when it begins as a bladder infection and then eventually starts to travel to the kidneys. This can develop slowly or it can be a chronic condition. The causes would be bacteria, a bladder infection, kidney stones, or obstruction of the urinary system ducts. Symptoms: fatigue, mental confusion, fever, nausea, pain in the back or abdomen, if your kidneys are enlarged, painful urination, and then cloudy or bloody urine. Treatment would be intravenous fluids, pain meds, and antibiotics. And then the last one would be the renal calculi, commonly known as the kidney stones. So this happens, they become lodged in the ducts within the kidneys or the ureters, becoming more severe disorders. You're not going to be able to urinate. It's extremely painful as those stones starts to move down the ureters into the bladder. Causes of this can be defects with the ureters, overly concentrated urine, which will form those kidney stones. You can have gouty arthritis, or if you have multiple UTIs. Signs and symptoms: fever, nausea, pain in the abdomen and back, a frequent urge to urinate, painful urination. And then treatment could be pain meds, IV fluids, medication to decrease that stone formation, surgery to remove those kidney stones. And then there is a process if the kidney stones are too big to pass on your own. It's called lithotripsy. So that's a procedure that will use shock waves to kind of break up those kidney stones enough that you're able to, get rid of them on your own. So that is our chapter on 30, the urinary system. Thank you for your time, and I hope you guys have a great day.